Department of Health. And aren't you glad, I know Jason's already left, but aren't you glad we didn't name our Medicaid bee the hog care? I couldn't help but think of that while I was talking. But coordinated school health, most of you are stakeholders and are partners, but is an 8-model program that the CDC put forward several years ago that Arkansas has been really strengthening in the last few years. 4 years ago, when I took that position, we had 2 schools that implemented the coordinated school health model in their schools and communities, and today we have 42. So it's been 4 years of fast growth. Thank you to many of the stakeholders and important, incredible colleagues that we have here in the spring. So that being said, we have focused heavily on tobacco prevention, on obesity prevention for the last 4 years because it's our state goal too, but it's also our federal goals that the CDC actually funds our state office. So we knew early on, 4 years ago, that we were also interested in the components of coordinated school health, of health services, and mental health services, psychological services. So we had been exploring and researching and trying to figure out how we were going to implement those 2 components of coordinated school health with when the tobacco tax that Frank Scott mentioned earlier was passed, and we have since got to fund 9 wellness centers, and as of last week I have become the wellness center coordinator for Coordinated School Health Wellness Center Initiative in our state. And you can see our map, and those are the 9 initial funded school districts. Well, actually they're schools. So we have like 2 elementaries, or 3 elementaries, 2 middle schools. How many is that left? No, 3 high schools. Anyway, it's pretty well divvied up, and we've got some rural areas and some urban areas, and we're just getting started. So we will be calling on you guys to help us figure out how this is all going to come down. This first year, we're expecting these wellness centers to hire a wellness center RN. In addition, this doesn't take the place of their school nurse in any way. This is the wellness center RN. They also will be hiring a licensed mental health person on staff. And another expectation is that they will move their existing promotion and prevention activities that they have going on in their school to their wellness center. They will be a resource for their community. They have developed a resource list where they can refer out to the community or bring the community in, whatever the need is. They have been chosen it was a competitive application. And as you can see, we do have 4 schools up in the Northwest. So, based on their application, we are going to be doing some education about grant writing for our schools. They really fall behind because it's not spread out around the state as much as we'd like to see. But these schools were ready. They have good applications, and they are partnering. Eventually, we want them to have primary care, some preventative promotion this year, but have APN physician services 2 or 3 years down the road. And some of them are already talking to the medical community. They're educating the community about what's going on. And this is a direct attempt to reduce access issues for children in Arkansas and their families. So we're hoping that these wellness centers will become the medical home for families and students that currently lack quality access to care. This is in no means supposed to supplant the students that have or patients that have PCPs and medical homes where it's working well for them at all. This is a gap filler situation. So I guess I'm making questions. I don't know because. Okay. I could talk about this for days. And I thought, how am I ever going to say all this in 12 minutes? And I probably did it in 5 because I was so worried about going over. But I will move on to the second one and find out what your questions are later.